Welcome back to the Nursing Topic channel. Let's see about hiatal hernia today. Let's begin. Diaphragm is a sheet of muscle that lies at the base of the lungs that separates the chest cavity and the stomach. There are a number of openings in the diaphragm through which the structures pass between the chest cavity and abdomen. Example, inferior vena cava, esophagus. So in hiatal hernia, what happens is the stomach pushes up through that opening into the esophagus. The small hiatal hernia doesn't cause much problems, but large hiatal hernia can allow food and acid to back up into the esophagus, leading to the heartburn. It is most common in older adults, and also it is very common in women than in men. Let's see about types now. There are two types of hiatal hernia. First one is sliding hiatal hernia. Second one is paraesophageal hiatal hernia. In sliding hiatal hernia, the junction of the stomach and the esophagus will be above the hiatus of the diaphragm. And what happens is the part of the stomach slides through the hiatal opening in the diaphragm into the esophagus. So when the patient is lying down, the stomach will slide into the chest region, that is the esophagus, and comes back to the normal when standing upright, and this is the most common type. The other one is paraesophageal hiatal hernia. So in this, what happens is the esophagus and the stomach junction remains in the normal position, but the fundus and the greater curvature of the stomach, that is the top portion of the stomach, will be rolling up through the diaphragm, forming a pocket-like structure. Now let's see about the causes of hiatal hernia. The exact cause is unknown, but maybe due to lot of contributing factors. The first one is weakening of the muscles in the diaphragm. This diaphragm is a muscle, and imagine if the muscle is weakened, so what happens to the hiatal opening? It will also be weakened, so the stomach can easily slides into the esophagus. And the second one is factors that increase the intra-abdominal pressure, like obesity and pregnancy, ascites, tumor, and tight-fitting undergarments, wearing tight-fitting undergarments, intense physical activity, and heavy lifting. And other factors like increased old age, trauma, malnourished, and chronic illness. Patient who will be bedridden, like lying in the spine position for a longer time, and other causes very rarely maybe congenital weakness of the muscles. Now, what are the symptoms of hiatal hernia? Think of the pathophysiology. The part of the stomach slides into the esophagus. So what will be there in the stomach? Acid. So this stomach acid that will backs up into the esophagus. So what happens? Heartburn. That is an important symptom. This will be relieved by sitting or standing, and always bending increases the pain. And the second most important clinical manifestation is dysphagia, that is difficulty in swallowing. So here the stomach slides into the esophagus, so there will be delay in the emptying of the lower esophageal sphincter into the stomach because of the obstruction. So finally everything will be delayed and there will be obstruction, so that causes a difficulty in swallowing. So always the symptoms of hiatal hernia will go in mimic with gallbladder disease, peptic ulcer disease, and angina. Now the complications of hiatal hernia. The first one is gastroesophageal reflux disease, and the second one is erosion, because of the acid backs up into the esophagus and that causes erosion, and finally hemorrhage, stenosis, that is narrowing of the esophagus, strangulation of the hernia, and the last one is regurgitation with tracheal aspiration. And always the patient with a history of hiatal hernia, they most commonly they get admitted in the hospital for some respiratory problem. And how this disease will be diagnosed? This disease will be diagnosed by barium swallow. So we can easily see the protrusion of the stomach mucosa through the hiatal opening into the esophagus. Let's see about the nursing management. So in the nursing management, the most important thing is teach about the lifestyle modification. So first important health teaching we have to give is reduction of intra-abdominal pressure. How to reduce the intra-abdominal pressure? First one is eliminating constrictive garments. So advise the patient not to wear any constrictive garments, and always we can go for a loose clothings. Second one is avoiding lifting and straining, and third one is eliminating alcohol and smoking. Fourth one is elevate the head of the bed, and last one is use of antacids and anti-secretory agents. And the second important thing is elevation of the bed on a 4 to 6 inch block. So this will assist the patient in maintaining the stomach in the abdominal cavity and prevents the reflux of acid back into the esophagus. Third one is reduce the weight if obese. The surgical management for this hiatal hernia is fund application. That is a wrapping of the fundus of the stomach around the lower portion of the esophagus. That is, a top portion of the stomach will be wrapped around the lower portion of the esophagus. So important objective of this surgical management is to reduce the hernia and to prevent the movement of gastroesophageal junction. Thank you for watching this video. If you have any doubts, put it in the comment section. If you like this video, please consider subscribing to my channel. Thank you.